Sure. So, I mean, the way I look at the way I look at Western medicine is with a couple of notable exceptions. Western medicine is very, very good at sort of treating symptoms. You treat for pain, you treat for inflammation. You don't always wind up treating the root cause of a problem. That's actually one of the reasons I got into alternative care is because in many cases, alternative care is really more about treating the root problem or supporting your patient as a whole organism to allow that organism to heal in and of itself. So regenerative medicine really, really sits in that space of, rather than cover up the inflammation but don't do anything, for example, about the osteoarthritis itself. Let's actually get to the cause of the OA and improve that scenario. So that way there's less pain and inflammation because, in this example, because the joint is actually healthier and functions better than it used to.
Yeah. So, kind of to play off of that a little bit, how does the platelet rich plasma itself kind of support that healing and make the joint better than it was before, and any other applications as well?
Sure. So, I mean, as any medical professional would know, there's all kinds of healing factors that sit within the plasma. So it's platelets and it's fibrin and other factors within the plasma that allow the body to heal. I mean, that's how we heal when we're injured. Um, when you wind up having, again, say a damaged joint, damaged cartilage surface, osteoarthritis, the body doesn't really do a very good job of managing that situation. And in fact, when I was in vet school, we were taught once the cartilage is damaged or worn, then that's it. There's nothing else you can do other than manage the pain. And the reality is that's not completely true. We don't really have the ability to kind of make the joint perfect again, but we do have the ability to dramatically improve that cartilage surface, improve the condition of the joint capsule itself, and those healing factors that are in that platelet-rich plasma wind up being, a significant part of that. In so much as that when we put those factors directly into a joint, they get to work on the cartilage, on the joint capsule, and really addressing the inflammation that is happening within the joint to improve that joint environment over time.